Greetings, folks. I'm Dan Grauman, the Managing Director and CEO of Veralon, a healthcare consulting firm that helps our clients tackle a range of strategic and business challenges, and as you know, provides a tech-enabled, video-based education solution for hospital trustees. We are delighted to launch this short podcast that reviews major healthcare headlines and news stories and what you need to know, with a focus on the provider sector. Welcome to this first episode, which will be followed by regular episodes every month or so. The podcast will live on our virtual board education platform. So let's jump right in. What are the recent headlines, and what do you need to know? Steward Healthcare declares a bankruptcy and plans to sell off all hospitals, as well as its physician entities. They filed Chapter 11, and this follows a cash flow crisis and cost-cutting measures that they tried. The big news here is that Steward was private equity backed and grew to own and operate 31 hospitals in 8 states. They faced a lot of mounting financial troubles, which has resulted in some serious questions about private equity involvement in healthcare, and especially for hospitals. Private equity in healthcare is facing a lot of headwinds. Several states, Massachusetts, Oregon, others like California, are underway in close scrutiny and oversight of private equity owning and operating hospitals. And private equity firms themselves report a lot of financial challenges, not only in the hospital sector, but with physician and other related entities. So more to come on this, but it appears that the bubble is bursting when it comes to healthcare and private equity. The FTC is being more aggressive in its enforcement of antitrust initiatives, and this, for sure, should be a focus for healthcare boards. Federal government is challenging more healthcare deals, and the board should expand its oversight of antitrust compliance. Despite this, the data and the activity into 24 is quite significant in the hospital M&A space. This activity will likely continue in response to the financial challenges that hospitals have faced in the last several years. And at the same time, the FTC will be scrutinizing more and more deals. The Federal Data Privacy Bill, or otherwise referred to as the American Privacy Rights Act, would impact breaches of health data. It's unclear at this time how this bill and HIPAA would interact, but it clearly adds to the mounting rules and regulations that hospitals and health systems must comply with, a trend that continues. The FTC has also issued a ruling that will ban most non-competes. The FTC voted to issue a final rule that would ban most existing non-compete agreements and ban new ones as well. However, the ban would not apply to not-for-profits. Of course, many hospitals and health systems enjoy not-for-profit status, so it appears at this stage that the ban would not apply to not-for-profit hospitals. Doctors would be more free to choose where they practice and where they work, as long as they aren't currently bound to a restrictive covenant as part of their employment in a health system. And this could very well cause issues for patients, especially in rural healthcare settings where there's already a lot of provider shortages. This rule was challenged immediately by the U.S. Chamber of Commerce, so there will be some time until it's clear that these rules get implemented because of expected ongoing litigation around the matter. But moreover, it's clear that beyond the federal level, a lot of states are moving in this direction anyway. It seems to be a trend. There's a heightened focus on cybersecurity following cyber attacks related to Change Healthcare, the Optum enterprise that severely disrupted healthcare payments nationwide for providers. Cybersecurity has been under a close, watchful eye for quite some time, and it continues to have intense focus. The SEC recently introduced disclosure rules, and we expect there to be more activity, regulatory activity, and laws that pertain to cybersecurity. Health systems are experimenting with the best uses of AI, artificial intelligence, in patient care. Becker's reports Intermountain Health is deploying artificial intelligence to automate clinical note-taking, to reduce the time that their clinicians spend on documentation, helping them be more efficient. More to come on AI. It is positioned to disrupt a lot of healthcare delivery. Hospitals, health systems, and their boards need to understand the implications of AI as it continues to unfold and unravel. Lastly, Walmart Health closes its clinics. VillageMD, which is owned by Walgreens, is scaling back, and Optum is closing its virtual care offerings. So what does all this mean? Corporate retailers made a big move into healthcare delivery and clinics, and they're very quickly changing course. No surprise, big publicly traded companies like these will pivot from a strategy if it is not working out financially. Walmart closed 51 health clinics and its virtual care services. Walgreens VillageMD scaling back its clinic operations. $1 billion of cost-cutting measures, and United Health Group, again, its Optum entity, announced the closure of its virtual care offering. These scalebacks and closures really call into question the degree to which major retailers will play a role in disrupting primary care delivery. It's fair to say that they're learning that this is much more difficult than they might have expected, as much as they all want to jump in, participate, and try to make healthcare delivery and financing better. That covers the major healthcare headlines for the last month or so, and we'll have more to report for you going forward in the months to come. Thanks, and appreciated the opportunity to share these insights.